Well, good morning. It was a pretty nippy morning coming out here. It was so cold where I live on the other side of town that I saw two lawyers with their hands in their own pockets on their way here. If there's a lawyer out here, I didn't mean it, I know. Lawyers tell doctor jokes all the time. That's okay. That's okay. So, I wanted to speak today a little bit about perseverance, about not giving up, about overcoming obstacles, about seeing things that appear to be large, complicated, insurmountable problems that really, when you take them apart, can be addressed. And when I was a kid, my hobby was putting together model airplanes. And, the bigger kits would have 500 pieces or a bazillion pieces, and the even bigger kits. And you would have to do them section by section by section by section. And it took a long time to really put together a model of the Constitution sailing ship with umpteen guns, or an F-14 fighter, or B-24 bomber, or all kinds of different things. But what did you learn? You learned that all of those little pieces could be part of the bigger piece. And if you had perseverance and you really stuck to it, you could actually do something and put the kids together and do them well. So that stood me well in school. And when I was in high school, we had the guidance counselor who would come to you at the end of the year and say, okay, what do you want to do? And here's what we suggest you do. And my mom and I went in. My father had died. My mom and I went into the guidance counselor, who I had never seen before. And he pulls out all of these tests and he says, here's where you score. You're average. I said, well, okay, you're average. And that school you applied to, you can't go there. We haven't had someone go there in 15 years. I said, wow, they pay this guy to give all sorts of great advice like this? So I said, thank you very much, and who is this man anyway? And then went off to the good school. And it happened again in medical school. And it happened again after medical school. And it's happened, and it's happened, and it's happened. It happened when I came to Columbia. We decided to go and open a pediatric practice in the Eau Claire area. Now, I was not from Columbia. I know nothing about Eau Claire, really. And all I knew was that the Census Bureau said that the poverty rate there was 25%. So I said, well, hey, if 1 out of 4 people can't pay, and 3 out of 4 people do, then that's fine. You'll be okay. Not the way that it works. Not the way that it works. When all the other pediatricians in town knew that we would accept poor folks, they graciously sent their poor folks to see us. So it was not 25%. It was 40, then it was 50, then it was 60, then it was 70. At 70%, I had to get an extra job because my job wasn't paying me, it was paying the staff. We had to borrow money. At 75 and 80% poor folks, we had trouble paying the money back, and I had to get another job working at the Army base part-time and join the Army Reserve for a retirement plan. So I said, well, surely there's something wrong with this program. If we're supposed to look after our brothers and we're supposed to do what's right, then we're doing it and we're losing our shirts. Something is wrong. We decided at that point, there were 3 of us, we decided at that point to scrap the private practice model and to go for a not-for-profit model and to seek grant support to see all the folks who were coming to see us. And thus began the journey. We opened in Eau Claire against the advice of the police. I thought that was interesting. I didn't even seek the advice of the police. But they came by and they said, after the building was built across the street from the Eau Claire High School, they said, what are you doing? Why are you here? This is too dangerous. I said, now you tell me. So I had advice from my pastor. My pastor came over and he said, I think you're interfering with the Lord's judgment against these people. I said, what? What? You're supposed to be the encourager, the exhorter, and not the guy that says that. And my wife says, gee, should you buy a gun? And I said, well, I don't know. Do you think we should buy a gun? I don't know. So 1981, we launched the practice. 1993, the practice was going under, and I had 3 jobs. 1994, we said, we'll make it into a not-for-profit. I went over to the hospital, which I shall not name because I know there are people here who are affiliated with it, but it was in Richland County. And it was really big. And I did ask, I said, you know, I want to set up this thing called a not-for-profit health center. And what do you think? And the chief financial officer said, I think that it's too complicated for you. I said, uh-oh, sounds like that guy in high school. And he said, I think that it's too expensive, not only complicated and expensive, but I don't think you can do it. I said, uh-oh, it's that guy in high school again, that guy with that average thing. So I said, well, thank you very much. And then I went to a development department, and I said, how do you raise money for a not-for-profit? And the guy said, well, if I were you, I would go see Sterling Sharp. And I said, who's that? And they said, I was into baseball. And they said, who's that? And they told me who it was. And lo and behold, don't you know that his agent was a patient in our practice? I went to the man, did a 15-minute blurb, and he said, this is great, Sterling will love it. Didn't see Sterling, but he basically signed on for Sterling, and shazam, we had a building. Building number 2. And we were ready to go with some serious pediatrics. And time went on, and time went on, and up till today, we're on building number 12 today. That one solo practitioner has now convinced 35 other practitioners that this is the team they should be on. And we have a staff of 200, and we do 30% of all the people in poverty who are in Richland and Lexington County. 30%. And we do that with 1% of our budget, 1% coming as a donation from Richland County. What would happen if they got on board and it was 5 or 10%? A lot would happen. A lot would happen. But we can soldier on with less than 1%. Now, okay, so an insurmountable problem, healthcare, complicated, expensive. Yeah, it's complicated. Yeah, it's expensive, but it's not the moonshot. It really isn't the moonshot. Somebody say amen. Amen. Thank you very much. Good preaching up here. Come on, good preaching. It really isn't the moonshot, and it really is something that we can tackle as a community. Now, I want to give you an example of tackling a similar thing in a community with even fewer resources than Columbia. Now, where is this? Is this in Brazil? You know, these neighborhoods are kind of universal. If you've traveled around, you'll see these in India. You'll see them all over Southeast Asia. You'll see them all over Africa and all over Central America. These are where the real poor people live. You know, the federal poverty level in America for a family of 4 is $22,300. The federal poverty level in an area like that is probably a couple of $100 a year. So this is an insurmountable, terribly, terribly, terribly complex problem. What on earth can you do about it? Well, most people will just be stymied by it. You know, look at it and say, well, what can you do? This is horrible. And this photo does not do justice to the scale of this neighborhood. This neighborhood was like 7 square miles of this. There were no roads, no sidewalks, no services, no utilities, and everything was made out of plywood and corrugated metal. But the people had an idea. They had an idea that they wanted a clinic. There were 12,000 people, no medical services. They wanted a clinic. They just happened to sit next to a titanium mine. This is in South Africa where they mine titanium. And the titanium company said, you know, we're kind of encroaching on this community. We will build a clinic there if the community can raise $50,000 of seed money. The government came along and said, if the community builds this thing, we, the government, will staff it, will equip it, and will fold it into the provincial budget and run it indefinitely. The problem is the people had no money. I was asked to go talk to these folks because we had some experience in setting up clinics. I didn't want to go. I kind of kept putting it off for 3 years and finally went and spoke to this person. Now, this person who lived in the high rent district of that community, the house you see behind her is really two houses superimposed. Her house is a 10 by 10 concrete block structure. And she stands approximately 5 feet 1/2 inch tall, 72 years old, a little Zulu lady. And she said, looking at me, I am going to put all of my land, my 4 acres, my ancestral land, I'm giving it to the community for the community clinic. What are you going to do? I said, well, ma'am, I'm just a consultant, you know. I'm just here to tell you how to do it, you know. So basically, she had thrown down the gauntlet, and it was the biblical example of the widow's mite, where the widow in the temple gave 2 copper coins, and she gave from her poverty, and the rich folks were giving from their excess and from their wealth. So she threw down the gauntlet. All she had was going to the community clinic. And I said, yikes. And I knew what I was going to say, and I didn't want to say it. And I said, hey, we'll go back to America and raise the $50,000 and help you build a clinic. And I said, who do I know that has $50,000? I asked all my neighbors and had 0. I asked all of my doctor friends and had 0. And I was running out of relatives, and I had 0. So at the point of despair, I made the last 3 phone calls and generated $50,500 in 20 minutes. It was astounding. What can you not do? What can you not do if people come alongside to help? And if it is in the will, of our Father, what can you not do? So what has happened now is that over there, in the midst of all of that, they have that. Now, this is not, you know, a bamboo roof structure. This is 9,000 square feet of good clinical space where the government kept their promise to put in all the equipment. They put in a pharmacy. They staffed it. It's up. It's operating now. It's seeing a bazillion people a year, and it's doing what the folks there had dreamed of for who knows how long. But in the fullness of time, when all of the ingredients and participants come together with that idea and are willing to go out and assault the barricades for it, that's what they have. Now, this is in a town that has resources that are a little bit more subtle and a little bit lower level than Columbia. What can Columbia do? If those folks can come up with this, what can the folks here do? The answer is whatever they want to do. Whatever they want to do. We can stand here and hope that somebody does something for someone, or we can make it happen. We can make it happen. It is not the moonshot. We can make it happen. You can make it happen. You know people that you can call on the phone if you have to, and you know people that you can get really excited about an idea if you have to. And there are good people that are full of ideas who are just waiting for something to come along to have that idea gel around something. It is possible. You are the folks who can do it. And as our generation, my generation, gets older, pretty old, then we must pass the baton to the next generation. And you guys are the next generation who have to take this baton and run your course around the track for however long it takes to get the work done. So, on behalf of all those folks who have been told, no, it's too complicated, no, it's too expensive, and no, it's too hard, who have not given up, on behalf of all of those folks who have not given up, I graciously give you the baton.